Hi everybody. Welcome to our June So What seminar, and thank you for joining us on what's quite a sticky evening, but nice to have the sunshine. Hope you've all got sunshine where you are. Our topic for today is around how we can accurately represent and understand mental health difficulties. And we've got some fantastic speakers who I'll introduce you to in a minute. But I just wanted to start with a little bit of housekeeping. So just if anyone finds them useful, there are closed captions, so you just need to select to show captions and you'll be able to make use of that. The chat is disabled, but you can put any questions that you have in the Q&A, and we'll have a discussion slot at the end where we'll try and pick up as many of those questions as we can for discussion. And just let you know, the webinar is being recorded, so we will make that available on our YouTube channel as soon as we can. Also, if you do experience any technology related issues, you can pop those in the Q&A as well, and the fantastic team that are helping us out today will get back to you on those issues. Great. If we can just go to the next slide, I'll let everybody know what the programme for this evening is. Fantastic. So at the moment we're in the introduction. Usually I just sort of kick off and introduce everybody, but I'm going to do a little bit more sort of setting the context in this discussion. So a bit more from me, and then I'll hand on to Julian and Victoria to talk about a new project where they've been developing an image-based mental health measure. And then Ro and Jenny will be talking to us about more accessible approaches to being able to capture mental health difficulties. Then we'll have plenty of time with our Q&A panel, including our young person and parent carer champions, who you'll be able to see in a minute. And then I'll just make some concluding remarks. So that's the rundown. If we can go to the next slide. We can do some introductions. So I'll stop, but if those who were involved could maybe just pop their cameras on for a minute, and I'll ask you to introduce yourselves. So I'm Jess Dayton. I'm Director of Applied Research and Evaluation at Anna Freud. I'm also based at UCL, where I'm a Professor of Child Mental Health and Wellbeing. And stitching those two things together, I'm Director of the Evidence-Based Practice Unit, which is really a collaboration between those two organisations. And Julian, do you want to say hello? Oh, sorry, I forgot to mention my pronouns are she, her. Julian, over to you.
Thanks, Jess. Hi, everyone. Thank you so much for taking a bit of your evening out to be with us this evening. My name's Julian. My pronouns are he, him. I've got kind of roles at Anna Freud and UCL, like Jess. I'm the other co-director of the Evidence-Based Practice Unit. So yeah, I'm a researcher, and one of my main areas of interest is about how we can empower young people and families to actively manage their mental health and mental health support.
Brilliant. Thanks, Julian. Victoria, do you want to go next?
Hi, my name is Victoria Christodoulidis. My pronouns are she, her. My role, I work part-time at Anna Freud and with UCL as a visiting research fellow, and I've been working on this project. And other bits of work that I do is working in and around mental health, specifically trauma orientated, and very much looking at working in co-production environments. So yeah.
Lovely, thanks, Victoria. Ro, would you like to introduce yourself?
Let's get all my knobs in the right place. Right. I'm Ro Rossiter. I'm a clinical psychologist by background, and I guess for the last probably 10 or 15 years, I've been concentrating on what we could call perhaps participative practice development and evaluation. So lots of collaborations, and we're going to talk about two of the recent projects today, often working with folk with learning disabilities, but also broader than that. Oh, and that pronouns she, her, but I'm equally happy to be they, them as well. Thanks.
Thanks, Ro. That's fantastic. Jenny, would you like to introduce yourself next?
Thank you, Jess. I'm Jenny McKelvey. My pronouns are she, her. I'm a clinical psychologist. I work with children and with additional needs in South Wales. And I suppose that what I'm really passionate about is trying to hear from people who perhaps communicate in ways other than language. So I work with children with learning disabilities and also other additional needs. And I think the reason why I've been so delighted to be working alongside Ro in a couple of these projects is to really try and understand how we communicate with each other as kind of human beings, and how do we understand if we're thinking about kind of mental health difficulties and how to capture them, how can we understand them without using language sometimes as well. So I'm hoping we can discuss some of that today.
Thanks, Jenny. I'm really looking forward to that discussion. Perhaps Dylan, if we go to you first.
Hello, my name is Dylan, and I am a parent champion at Anna Freud, and I'm just here today to be curious. So looking forward to it.
Sounds like a brilliant reason to be here. Thanks, Dylan. Let me just double check whether we've got Parvin yet. Hopefully they'll join us in a little while, but Parvin is Anna Freud Young Champion and will be joining us for the panel discussion. And Martha, do you want to introduce yourself?
Yes, hi, I'm Martha. I'm the Programme Coordinator for Applied Research and Evaluation here, and my pronouns are she, her, and my role today is very much going to be in the Q&A, so you're going to hear more from me later.
Thanks, Martha. Great. If we can move on to the next slide, then I'll just say a little bit more about the evidence-based practice unit. So as I mentioned just briefly earlier, it kind of stitches together both Anna Freud and UCL in that it's a collaboration it's quite a long-standing collaboration, actually goes back about as far as 2006. And we're really interested in building research and innovative practice in children's mental health. And the work that we do is very much on an applied basis. And we apply what we call the so what principle, which is what we also front end all of these seminars with, which is essentially all of our research really should have a bottom line. If it doesn't tell us something that's helpful for those working closely with young people and families, then potentially we shouldn't be doing it, really. So we're very much at the sort of very practical end of research, and we also work very closely with the Child Outcomes Research Consortium, which some of you will be familiar with. They are, well, they're more than just a membership organisation, but they very much focus on using evidence to improve children and young people's mental health and wellbeing. Next slide, please. One of the things we do in the evidence-based practice unit every year is we try and pull together themes from all our research, particularly our research, what we call outputs, so things like our reports, our briefings, our research papers that we produce each year, and we pull them together into what we call our key findings booklet. It comes out around about December each year. We like to see it as our Christmas present to ourselves and to everybody else. And we sort of theme the findings in a way that we hope is sort of accessible. So do keep a lookout for that. Great. So that's the kind of broad background and introduction. I just wanted to set a bit of context with the slides that come next. So perhaps if we can go on to the first one, I just wanted to sort of start by kind of taking us back to, I think mental health is one of those terms where we can talk at cross purposes. There's a phrase that I like called jingle jangle. I don't know if anyone's familiar with it, but essentially it means that sometimes we can use two very different terms to refer to the same underlying thing, and also that we can sometimes use the same term to mean different things. And I think mental health is one of those terms that's particularly susceptible to this. So I thought it might be just helpful to look at some definitions. I won't read them, actually, you see them on the screen there, but essentially there's some common themes about symptoms and behaviours, but also around experience of distress and sort of functioning, how mental health challenges might really kind of impede your ability to interact with your day-to-day life. Next slide, please. And quite often we'll talk about, almost in the same breath, mental health and well-being. And sometimes we can use the terms interchangeably, which is back to that jingle jangle point that I was making. But there is a distinction between the two, and the definitions can change slightly. So the first couple there are from What Works for Wellbeing in the Children's Society, but we also did a piece of work in collaboration with young people a few years back now, and the wording they liked was essentially wellbeing is about them feeling good, feeling that their life's going well, and feeling that they're able to get on with their daily lives. So you can see, there's a lot of similarity in some ways to talking about mental health and mental health difficulties. But yeah, I'll maybe talk a bit more about the distinctions on the next slide. So some people think of mental health problems and well-being as being sort of different sides of the same continuum. So on one end of the spectrum, you have mental health problems, and at the other end is, sort of positive well-being. But actually, when we look at the research evidence, what we can see is there is actually a distinction between those two things. They are very related to one another, but they are distinct in terms of what they mean, but also in terms of what has an impact on those things. So we find that there are some drivers of well-being, for example, that don't impact on mental health problems, and the other way around. So, but I mean, all of those, when we talk to young people, feel like, interrelated and very important aspects of how they experience their own life. Next slide, please. When we think about measuring mental health, we kind of know all of those things that I've just described, that it's sort of a complex mixture between symptoms, distress, behaviour, functioning, that it does interact with well-being. But when we then get to the tools that we might use, particularly in, the sort of prevention, early intervention work, we tend to then reduce that down to something that's very much focused on, getting a brief scale, and often that means focusing almost solely on symptoms. So these are just two examples of some quite commonly used mental health measures. One is the short mood and feelings questionnaire, which focuses mostly on depressive symptoms, and the other is the strengths and difficulties questionnaire, which covers a broader range, so emotional difficulties, behavioural difficulties, peer problems, and so on. But there are some sort of limitations, I suppose, to using these tools, because they very much focus on symptoms and miss some of the wider aspects that I've just talked about. They also rely on a degree of introspection and self-reflection, and an understanding that when we're talking about symptoms, we mean something that's fairly stable over time, not a sort of in the moment experience. And that can be quite problematic in terms of interpreting potentially how people have responded to these kinds of questionnaires. And I think they can also make us focus very kind of precisely, sometimes this is helpful, but sometimes not, on a very specific symptom profiles and what that means. But there've been some, advances in recent years that have led us to think about whether we need to take a different perspective on mental health, and whether these symptom kind of measures are neither kind of necessary or sufficient potentially to capture mental health. So I've said why they might not be sufficient, but if we move on to the next slide, and I promise it's not as complicated as it looks. One of the things that people have been thinking about recently in research is whether actually this complex set of sort of symptoms that we can often map through these kinds of measures really are all just tapping into the same underlying construct, essentially. So those of you familiar with the research literature will have heard terms like internalizing and externalizing, which essentially internalizing is emotional difficulties. It's quite a broad set of experiences, and externalizing is more to do with behavioral difficulties. But more recent research has suggested maybe there's something underlying even that, which is more what gets called in literature general psychopathology. But perhaps just move on to the next slide. What that essentially means is what we're seeing is perhaps just an underlying experience of emotional distress, or psychological distress, I suppose, experienced by young people. And what we actually see in terms of symptoms and behaviours might just be how we express that distress. So it's just a different way, really, of thinking about how we understand these things. And sometimes that can be helpful, particularly in contexts where, behaviour management becomes the focus, for example, and sometimes we forget to look behind behaviours and see what is the distress that might be driving those things. Next slide, please. Another thing that I mentioned before was just, what are the other factors that are important here. And one of the ways of looking at that is to say, well, what do we know about young people who access specialist help, for example? So what can we say of the experience of young people and what we know as sort of drivers of mental health difficulties potentially that predict those who are accessing specialist services? Because that might give us a bit of a sense of, you know, what some of the indicators of psychological distress or mental health difficulties might be. I don't need to go into the detail here, but just to say, what we find is that those kind of symptom measures, they do give us a sense of, they do predict who's accessing specialist mental health services. So you can see there we've got highlighted behavioural problems. That's based on a self-report tool, which does predict, essentially young people who experience behavioural problems are more likely to be accessing child or adolescent mental health services. But we also see actually it's more likely for those who are from more economically deprived backgrounds. It's more likely for young people who've got special educational needs. And actually the way young people report their quality of life, so their day-to-day ability to interact with and derive enjoyment from their life, which is more a kind of well-being indicator, actually also pretty well predicts who accesses specialist services. So if we want to get a sense of that group who potentially need help, we definitely need a broader conceptualization of the child in front of us, essentially. Next slide, please. So this is just a bit of a tour of some thoughts really about what we might be missing and how we need to potentially think again about how we capture mental health difficulties. So one of those questions is what we commonly measure necessary to understand mental health difficulties? Could we just look at distress, for example, to know who needs support? Is it sufficient in that we're missing sometimes well-being, we're missing sometimes functioning and other factors that might be important too, that I haven't covered here, but things like sleep and activity and that kind of thing. Are the measures we have accessible to all young people? So, are they, do they rely too much on a good handle on language or a good insight into symptoms? Are the measures flexible enough to be meaningful to those using them? Do they feel like they fit the experience of those individuals? And are we taking enough advantage of new approaches? These are still very much self-report questionnaire instruments, and obviously there've been lots of technological advances. So I think all of these things cause us to think, well, do we need to revisit these things? And some of the projects we're going to hear about today are a really sort of fresh look at how we can approach this and get a better handle or a better approach to capturing mental health for different populations of young people. So that's all I really want to say in terms of context. I think I will now hand on to Julian and Victoria to talk through their image-based measures project.
Lovely. Thank you so much, Jess. And yeah, good evening again, everyone. Yeah, a huge thank you for spending your time with us this evening. I'm really delighted that we're going to be talking about the image-based mental health measure project. I'm going to be introducing it, and then Victoria is going to be kind of going through the detail of what we've been doing in our attempts to try and develop a kind of new way of asking young people about their mental health, as Jess was saying. It is a project that's live at the moment. We're very much in the thick of it. So it is a work in progress. We're not at the final version yet. But I suppose today we really wanted to kind of give people a bit of a sneak preview, tell you about the journey so far, but also to say, we'd really welcome your feedback, your thoughts. So yeah, please feel free to reach out to us after the session, or you can use the Q&A chat in Zoom as we're going along. So moving on to the next slide, please. So I'm going to be just very briefly contextualizing the project, and then I'll hand over to Victoria, who will give us a kind of overview of what we've been doing and teasing out some key learnings that we have so far. Yeah, we've introduced ourselves, but again, on the next slide, we just wanted to show our faces and say hello. so yeah, we've just kind of shown who we are. If we can move on to the next slide, please. And here, what I wanted to do was say a huge thank you. It's been a real team effort, this project, and I wanted to say a huge thank you to Victoria for your fantastic leadership of the work, but also a shout out to Julia Ravaccia, Hotriella Patti, and Sophie Johnson, who've been really fantastic researchers working on the project. And I want to say a really heartfelt thank you to our incredible co-researchers. And Victoria will be telling you later on about the amazing work that they've been doing. So yeah, a particular thank you to them as well. Moving on to the next slide, please. So yeah, just a bit of kind of scene setting for the project. So it's funded by the UK Research Innovation Council, and they're involved in setting up a big adolescent mental health cohort study. So in that study, they're going to be following up the same group of young people year on year for several years to look at their mental health and their experiences over time. And as part of that, they were interested in commissioning projects that would really try and develop and test new ways and innovative ways of collecting information from young people. Jess has just been telling us about some of the kind of limitations of the existing approaches we use. So at the moment, one of the main ways we ask people about their mental health, as we know, is through text-based questionnaires. And we consistently hear feedback from young people that sometimes these measures can be hard to understand. They sometimes don't fit with their experiences, and sometimes they're not necessarily the most engaging to be completing. We also know that, and this is something that Ro and Jenny are going to be picking up in their talk, but we know that text-based questionnaires for young people can also be inaccessible. This might be due to the reading age, but it might also be because they perhaps haven't been designed to be used with young people with learning disabilities or with special educational needs. We also know that measures might not be inclusive. Perhaps they were developed with populations where marginalised groups were underrepresented, for example. So we were interested in how we could ask young people about their mental health, but in a way that doesn't rely on text. So we set out to try and develop an image-based mental health measure with the idea that in the future, perhaps it can potentially be tested out in the first stage of the adolescent mental health study. And one of the first things we did, I won't go into it today, but one of the first things we did was a review of existing image-based measures to then kind of inform the work that we did. I'm going to hand on to Victoria, who's going to kick us off on the next slide, please.
Oh, thanks, Julian, for a great introduction there to the project. Yeah, it's been a fantastic project, and it's been very involved, as I will kind of talk you through just very lightly what we've been doing and how we've approached the project. So initially we had a group of 3 focus groups with 3 different sets of people. So we had practitioners, researchers, and young people, and we wanted to really understand, what were some of the challenges and barriers to engaging with the current measures, and understand what would they like to see in an image-based measure. And we took all of that information into our workshops and presented this information and did a kind of a group level assessment with 10 fantastic co-researchers who looked at all of that information and also was thinking about their experiences as well alongside, and thinking, well, okay, how do we now structure this into actually creating a measure itself? So we spent about 5 workshops, or 10 in total. 5 of those were very much starting off looking through the data from the focus groups and coming up and designing, testing, and doing a bit of refining of what that measure could look like. And also another thing that we wanted to do is give an opportunity for these co-researchers to engage with the second part of the kind of cycle of work that we were doing and delivering a focus group, and also learning about analysis. So it was more than just coming in using their understanding of the measures themselves and just producing something, but they've also got something out of it. The kind of next stage of what we did once we kind of paused at doing some training, and we got so far with the designing of the measure, was we revisited the 3 groups from the original focus group cohort that we had, and invited them back in to have a look at what we had created. And what was really great about this is that our co-researchers had, through their training, the opportunity to design the questions and how they might want to approach the focus groups. And also some of them wanted to get involved in the delivery as well, which was really great. I felt that they were able to do that. So we gathered some more insight, feedback, how well things were going, what needed maybe some further work. And then we took that into the last kind of 5 workshops back with the co-researchers, and again going back through the refining the measure even more so. So we're currently at the stage, as Julian said, we're not quite finished at the moment. We are going to be having interviews with about 15 young people to discuss the measure. So they'll be looking at the measure and telling us what they like, what they don't like, what can be changed, and providing us some more information so that we can go back and see what we need to change for the next stage. Next slide, please. Very lightly touching on this, as I want to get to the measure, but the whole premise of what we were doing, and yeah, I think it was really great that Julian saw that this was such an important part of it, is an element of co-production, or I say an element, it was completely embedded with co-production. And what we mean by that is a lot of research quite often will ask people to be involved, and we will go in, ask questions, take what we want, and go off and go away and be done with it. We've got everything we need. But while that's an element of participation, the kind of difference with co-production is that rather than working on individuals, we're working with them. So we're really, we're not coming at a point where we are the experts and we know what we're saying, nor are we coming at the point where we might not have the lived experience, but we just want to take it and make our own interpretations and design what we want to do. We're really coming at it together. So the everything that we were doing, down to kind of what the measure could look like, also how the young people, the co-researchers wanted to work, were there specific ways in which we can set out the room and how we were working, what we might cover within the sessions, how they wanted to communicate with us. All these things were really important to really making sure that the measure was embedded in something that they felt was relevant to them and that population. So there's lots of different things that we did in order to support that, and I won't go into it at this point, but just that it was really threaded into every single thing that we did all the way through. And a lot of the approaches that we used, and I will show you in one of the slides coming up, a lot of the stuff that we used was technology based and incorporating an element of creative practice. So that proved really, really effective. Next slide, please. So yes, as I was saying, creative and collaborative tools. So one of the things that we felt would be really useful, especially as we were doing something that was image-based, was use a tool called Miro. And Miro is an online interactive, it's like a whiteboard, that the young people, the co-researchers, could come in and work collaboratively together, but also independently on tasks. And that was exceptionally effective. And if we can go on to the next slide, I will talk. Firstly, please don't worry too much. Yes, you can press play. Don't worry too much that you can't see too much of the detail, because I'm going to talk to you about that in a little bit. But I wanted to give you a bit of an oversight of the tool if you haven't seen it. But it's this big whiteboard that seems to expand infinitely with the more stuff that you get, which was quite ironic because we did keep on growing with the kind of information and what was created. But here is just an example of what we showed the co-researchers. We pulled together the information from the 3 focus groups. This is what they first saw. And we kind of looked at what things do we need to keep. We categorized that. What did they want out of it, and certain considerations and ideas for the measure. So this kind of collaborative tool was really useful because the co-researcher could come in and they could organize things themselves and add notes and comments and various other things as well in real time. So this was a really, really helpful tool as well. Next slide, please. Thank you. So this is another part of the same tool, which you can see this exponential growth of this Miro board. That, yes, it has a variety of different storyboarding that we ended up creating. So yeah, this was really exciting because it was an image-based measure. We really wanted to look at a way of incorporating images in their kind of ideas and design of what they were doing. So this interactive storyboarding was a really effective way. It provided a bit of a template which had various pictures and things that they could use, but also it had the opportunity for them to go and find additional pictures and carry out, I suppose, a collection of images and scenarios of what they would like the measure to look like. Now, what was really particularly difficult about this measure, and if you can go on to the next slide, that would be great. What was really hard, we certainly found this at the beginning, was we were trying to build a measure purely on images, and mental health, as we've already discussed earlier on, it can be understood in lots of different ways, but it can be quite abstract and complex to draw together into an image. And our co-researchers, including ourselves, were finding it quite challenging to try to figure out how do we, create a measure that is capturing these abstract things in a way that can be understood. And it was really, really difficult. And all of us were coming up against it, saying this is quite challenging. And then what came out of our reflection from one of the sessions was the fact that actually having an animation within the scales that we had already would be really useful. So a lot of what had come up already was a little similar to some measures that might be used with images and a sliding scale. And we wanted to do something a little different. So we thought, actually, let's incorporate an animation and something moving that can explain what we're trying to say, potentially without words if needed, more effectively. So this is the template that we had decided that we came up with. And we would have, and I'll show you a working version of this, but this is kind of what we had come up with to help us work through it. And if we can go on to the next slide. This is kind of a little bit more, it suddenly changed in terms of what everybody knew that they were going to do. They suddenly thought, oh, right, if we create images that are around, that have kind of some form of animation, there's more possibilities and ways that we can communicate what we're trying to say. So here's just one of the examples of some of the things that started to be created, and we found that people, the co-researchers suddenly got an influx of confidence and understanding about how they wanted to deliver this. One of the things I did want to just highlight on this one, there is a kind of a body skeleton here that was a depiction of a body, and there were a couple of pieces of, I suppose, well-being and mental health attributes that the young people and the co-researchers really wanted to capture. And I think, one of the things that we will be doing, a little later, not within this tranche, is thinking about how we can incorporate them, because some of the things that we were looking at were quite complex to get across, and we really wanted to spend a little bit more time on those things. So we've not been able to incorporate everything that we would have liked to within the measure. But I think one of the really interesting things that came up was the breadth of the things that the young people and co-researchers actually wanted to incorporate within a mental health measure. It was much more than just, say, using some of the diagnostics, measurement of, say, depression or anxiety, which is the things that we have concentrated on at the moment. But it highlighted that they want to capture more, and they want to utilize the measure in a more personalized way than they are currently. If we can go on to the next slide. So this is Anime. So Anime is the character that was designed and co-created with the young people and named actually as well. So one of our co-researchers came up with Anime, and yeah, Anime is yes, the character within the animations that tell the story, that we'll show you in a second. So if we can go on to the next slide, and this one does have sound, so I will stop talking for a moment when we go on to it, but just a little bit of, yeah, please press play. Just a bit of an oversight of the measure itself. So we have a preferences log where we can actually personalize the measure, and this was really important to young people. They didn't want it to look clinical. They didn't want it to be something that held those, I suppose, experiences what they previously had. And you can select subtitles, audio. You can use open dyslexic. There's various different settings that you can have. And here is just one of the questions and how it looks in the outline. And I'll shut up now because it'll get a talk.
For these questions, move the slider to where it is most like you. In this example, Anime's energy levels are low. They stay low even when doing activities they like. Anime's energy levels stay low all day. In this example, Anime's energy levels are high and stay high all day.
And so this is a classic overview that you would have maybe an introductional preamble video that says how to do the measure. Then you'd have typically 2 videos contrasting videos that show, this is a example of it maybe not being quite so good, and this is an example of it being a little better. And then you would move the slider to where you feel that you are most like. And you would go through a series of questions that have that outline and talk through that. And as I said, the whole measure itself has lots of preferences that can be altered dependent on what the individual wants. And that can include having no sound, as I said. You don't even have to necessarily have the text and things like that either. So there's lots of different ways in which we can personalize it so that it is more accessible for young people to use. And I think the other thing to that we're still looking at, and we're still and we're aware of, is that there are lots more things that we could incorporate. There are so many things that we could incorporate within this measure, but this is, I suppose, the crux of what we've been able to pull together within this period of time. And I think the young people have done, the co-researchers in particular, have done a fantastic job at kind of pulling something that is actually very complex to put together. They've done that incredibly well. So it's been fantastic. As Julian said, the team that we've had to work on this, to pull it together to where it is great. So I know that's a very whistle-stop tour of this measure. So I hope that it's made some sense and I've not flitted around too much, and I've given you a little bit of insight of kind of the approaches that we took and some of the steps, and then a little bit about the measure. So yes, please feel free if you've got any questions to ask us in the Q&A later. Julian.
Lovely. Thank you, Victoria. No, really great to see kind of where we're up to at the moment. So yeah, in terms of our next steps, as Victoria mentioned, we're recruiting young people for the final part of the project, where we'll be asking for their views, feedback, and also to kind of think aloud as they're completing the measure, so that we can try and get a sense of their kind of interpretations and whether they're kind of making sense of the measure in the way that we are intending them to. So yeah, if you think there might be kind of young people who'd be interested in this opportunity, please do let us know. We're recruiting at the moment. The other kind of big next step we're working on is to write up the different stages of work that we've been doing, and here we're trying to do a kind of reflection piece about the experience of the co-production work. And I think this one part of this that I found really interesting is to really kind of see the impact that it's had on the young people, not just in terms of the things they've learned about the kind of research methods, but also just seeing how much they've really valued the opportunity to kind of connect with each other and build relationships. But the thing that really struck me was in the last session, when they were kind of giving their feedback about how it had gone, and the thing they didn't like about the project was that the workshops were coming to an end. So hearing from participants what they wanted was to have more participation in the study was definitely a first for me. And then, yeah, our ultimate next step will be going on to try and collect data using the tool from larger groups of young people, so we can test the measure out and to kind of start to have a closer look at its properties and how it's behaving. So yeah, I think that takes us to our last slide. Yeah, a huge thank you. Thank you for listening. Thank you for your attention. And yeah, whether you'd like to hear more about the project, you'd like to give feedback, you think there might be kind of young people who might be interested in taking part in the interviews, we'd really love to hear from you. Jess, I think I'm handing back over to you now.
Yeah, you are. Thanks so much. Yeah, really fascinating stuff, and I can see, yeah, getting some questions coming in now as well. Great. And just as a reminder as well, if anyone has any questions, do just pop them in the chat before you forget and we move on to something else. But I'm now going to hand on to Ro and Jenny to talk us through accessible approaches to capturing mental health difficulties.
Brilliant. Thank you very much indeed. I think, is Jenny here? I can't see everybody on screen. I think Jenny will be joining.
Yeah.
Yeah, you're here. Oh, brilliant. So we said hello earlier, so delighted to say hello again. And we're going to share some learning from some collaborative projects, which I think are going to include quite a lot of touchstones and similarities with what we've been hearing about from Julian and Victoria, although very low-tech version. So it's really exciting to hear about and to see the use of technology. So next slide, please. We're hoping to summarise and showcase and do some signposting from these two collaborative projects. And obviously we'll be thinking about how that links with the seminar title. So on with the show. Next slide, please. So the two projects we're going to talk about are these two, which are relatively recent. The first one is entitled Feedback and Outcome Measures, with the feedback really being very much about hearing the voice, and taps into what Jenny was talking about earlier, with that connection and really connecting with people, and focused mainly on folk with learning disabilities, but some broader. And then the second one is the accessible goal-based outcome. Next slide. Thinking about why this might matter for all of us. And this is just a slide reminding us about the Equality Act. And we may have people from other countries or jurisdictions, but pretty much all of us will have some kind of Equality Act, which is about promoting equality and reducing inequality, and many will have a whole range of different characteristics, and I think it's really important to be thinking about the sort of intersectionalities across these different aspects, not to privilege one category and not to make assumptions. So very much thinking about taking care with names and labels. Next slide, please. This just builds a little bit more on that, about thinking, why does this matter for me? And there's a few factors affecting how we all function, which won't be new, I guess, to many of you. With the neurodiversity, there's actually a really nice publication folk may have come across from the Anna Freud Centre, which is Neurodiversity in the Early Years. So they might put it in the chat if you haven't seen it. Although it talks about early years, really it's applicable across the lifespan, and it's a very nice, accessible one. So all kinds of neurodiversity, our development experience, life events, etc. You can read it for yourself. At the bottom, thinking about the ability or the disability of the environments or services that we're in to meet our needs. So going from a sort of individual problem model to a more contextual model, and just recognizing that much neurodiversity is unrecognized or misdiagnosed, and the references there are to two of them are to Amanda Kirby's work, and you'll be able to find those in the reference lists that are on the back slides. Next slide, please. Jenny.
Yeah, okay. So I'll speak for a bit, Ro. I'm not sure how familiar you guys are with this picture, but for us it feels very important in the work that we do, depicting ideas around what might happen on the left, so what might be happening in reality around us, and the idea that perhaps some people get more than they might need and others might get less than they might need in order to kind of access the world around them. And the way that this picture sets things out then is it talks about equality, where there is an assumption that everybody benefits from the same supports. But as you can see, that means that the same supports doesn't necessarily meet the need of the people who are wanting to access or access the world around them. Then it shows you that picture with equity, where everyone gets the support that they need. And then this produces equity, and then the idea of justice. I actually, I'm linked in with a movement called Psychologists for Social Change, and they wear they've got a T-shirt that talks about equality is the best therapy. We might need to change that now to justice is the best therapy. But I think really wanting to hold in mind that idea that linked with me with what Jess was saying about quality of life being linked with mental health difficulties. And certainly with the children and young people that we're working with, often we will see that perhaps if you look a bit deeper than what people are presenting with, that perhaps a lot of why they're behaving the way that they're behaving in such a distressed way could be to do with this lack of justice in their ability to access the world around them.
Could I just jump in and say that I think some of what Julian and Victoria were talking about with their project actually speaks to this as well. So it's almost an example, I think.
Yeah, it's a great example. It's really exciting to hear about it. Thank you. Next slide, please. So yes, this is just the link to the project one. There's a website with lots and lots of different resources and also much bigger description than we'll be able to give today around that project. Next slide, please. And that's the project team. Really grateful to the people that are on this list and others who contributed in different ways, as you can see on the right hand side. So actually I think this is on the next slide, what I'm about to say. So if you could go to the next slide, please. So thinking about the children and young people that we were thinking about, a really wide range of children and young people that contributed either directly or indirectly to the project. Thinking about the abilities, as Ro has said, we're working with children with learning disabilities and other challenges in their lives, additional needs. In terms of evidence gathering, we were looking at database interrogation. So we were linking in with Cork and also the Millennium Childhood Cohort Study. I had to text Ro this morning to find out what that stood for. Is that right, Ro?
That's right. Yeah. Eric Emerson, Professor Eric Emerson has access to that and could look at strengths and difficulties data across different abilities for the project. Thanks, Jenny.
Yeah, and then so there were some direct interviews with children and young people, parents and carers, practitioners, and with charities and I think when we talk about interviews as well, I guess what we're talking about is trying to find the views of people in lots of different ways, not necessarily as Victoria was saying, not necessarily in that kind of standard interview format, literature reviews, surveys, and lots of networking. Next slide, please. So the outcomes of the kind of the main recommendations were, firstly, set goals that are meaningful when you're working with children and young people. Actively seek feedback in a variety of ways for involvement, not only in goal setting and review, but in caring for children and young people and understanding their mental health difficulties. And then making sure that you're choosing and using outcome measures and methods with a clear purpose. And I wasn't sure if Victoria was alluding to that sense of sometimes we use a questionnaire, it's very brief, we're not exactly sure how it might map onto a person's life, and again thinking about how what those guys are developing seems, has a really clear purpose. Okay, next slide please. So in terms of goals that are meaningful, I guess thinking about, and I guess Ro, you'll be building on this quite a lot as well in your section of this, won't we? So we might go through this, just skip through this, the idea that it's really important to think about when you're working with a child or young person to make sure it's personalized and individualized and very much co-produced, and make sure it's creative. I'm going to go to the next slide because I think, Ro, you're going to be talking more about it. Again, the kind of goals that we were talking about with children and young people can be divided into objective, so what you can see, more subjective, feelings rated, so what more kind of internal, and then the different elements, so you can look at things like frequency, duration, and also different settings. in addition, you've got things like quality of life stuff about trying new things and what's available in children's lives, as well as understanding of or confidence about a child's behaviour. And yeah, there'll be a link with the next slide, or the next slide but one, in a bit. Okay, next slide, please. So this is the bit I feel more confident in talking about, because this was my section of the project, wasn't it, Ro? So this is, as I said in the introduction, this is something that's really, really important to me, is how you think about feedback, how you hear right from the point where you're meeting with a young person with mental health difficulties or coming to you with distress. How do you understand what it is that they're trying to communicate to you? Not only through using language. So this, I think, is a bit of a building on a slide we've seen previously in terms of how we did it and what we did. So if we could go to the next slide, please. Yeah, so the outputs from this part of the project were that there were, through networking and talking to the people that we've mentioned earlier, we had, and you can, if you have a look on the website, you can see some good practice examples. So different ways that people were trying to hear from children and young people. And this ranged from, goodness me, there was somebody who has devised an intimate care plan for young people with profound and multiple learning disabilities, who was wanting to find out what it was like for these young people to experience intimate care when there was a plan in place. So she was working out ways to really understand from them how comfortable or not they felt about different aspects of the plan, through to an advocacy project that was looking at bringing children and young people together and really working out the best way of showing their voice. And then there was, for example, there was a school that was working with a group of children around belonging and what it was like to be part of the school. And that makes me think of Jess's distinction and overlap between well-being and mental health difficulties. I think that was a good example of really trying to promote the well-being of these children in a collaborative and a kind of co-produced way. In terms of themes, I guess what we had, which I think there's going to be a slide a bit later, is how children and young people can make an impact. And just wanting to say that in terms of how we should be trying to have conversations about children's own life and their own care, but actually our experience is that children and young people can impact on service development, absolutely on training and research and being part of conferences, and having that wider impact, as well as the cultural change and the importance of cultural change as a context for all of that. And then also how is the best way of promoting listening and conversation? Again, we're not going to go into a lot of detail. Please look at the website around that. But I guess just to really highlight the 3Rs model from Beacon House, if you look at the Beacon House website. So the idea there is that if you're wanting to have any kind of connection, kind of conversation, whatever a conversation is, with a young person, to think about, first of all, are they regulated? And if they're regulated, can we provide them a context in which they can feel that they're in a relationship with you, in order that then they can reason, or what I mean by reason is that they can have a conversation or communication with you where they're sharing. Oh, brilliant. Gosh, you guys are amazing. Look how quick you're bringing stuff up on the chat. It's brilliant. Yeah. So yeah, Beacon House is a great website to go and have a look at. Also some of the barriers. And then we had some guidelines. And again, I think there's a model that will come up later with Ro that gives a bit more detail about that. Next slide, please. And then the final part of it was very much, I think, again, it really resonated with me what you said, Victoria, near at the beginning of your bit, which was, choose and use outcome measures and methods with a clear purpose. So this was the survey and the interrogation of the MCCS. And included in the survey then were measures of symptoms and functioning. So what are people doing? Please correct me if I'm wrong, but my understanding is, what are people doing around the country? What are clinicians doing in order to try and understand outcomes for children and young people with learning disabilities?
Yeah, that was pretty much the case for this part of the project. So some of the things would be specific, would be familiar to some people, and others might not be. But I think we could just rattle through because I'm conscious of time.
Yeah, go on then. Let's go to the next slide. We're almost with you, aren't we, Ro? what's the best bit to pull out from that? Oh, these were the recommendations. So
shall I just pick
yeah,
this
go on, you
up?
carry on. You carry on. You
So
do
we
it.
had
Thank you.
sort of symptoms and functioning type things. So that goes back to what Jess was talking about and some of the previous one as well. So for learning disability specific, there was one, which was the Sheffield learning disability, but the goal-based outcomes, not LD specific, but it's what people are talking about on the ground as being something really, really useful. I guess the other thing is that we haven't talked much about, but it's really important, is thinking about the experience of the sessions and services. So that kind of empowerment, that connection, really, really important. In the project, there's also these 30 additional measures that were named, and then you can see some of the themes that Jess had talked about earlier being parallel there, and then perhaps some more specific, but very much not just what tool, but how you might use the tool. And actually, I think that will go for the technology thing as well, you know, how it's introduced, how people are supported to use it, perhaps. Thanks, Jenny. Next slide.
Next slide, please. Oh yeah, so this is what I was alluding to earlier, just the idea that children and young people, and all of us, I think, can influence at those different levels. Let's go to the next slide. I think that's you, Ro.
Yep. So just again, whistle stop letting people know about this second project that basically builds on the first project, but wanted to make a little bit more concrete examples and a bit more guidance available to folk. And so it is hosted by the Goals in Therapy website, which many people will be familiar with, which now has the accessible goal-based outcomes project on its website. So have a look at that, but I will whistle stop through a few of the things about it. Next slide. So yeah, I've just told you some of this. In addition to some of the folk from Project One, we had a learning disability community nurse join us, which was great on the team, and two of Jenny's, one's an assistant psychologist and one's a parent peer mentor. Anyway, both folk with lived experience as parents, and then a slightly smaller list of collaborators and contributors, adding in the Goals in Therapy web and folk, so Duncan and his people, and we didn't have any extra funding, so thank you very much to the NHS trusts who supported us for that. Next slide, please. Again, people will be able to look at the outputs if they go on the web. So there's introduction, origins, and the aims. There are top tips for making working with goals more accessible. And again, it'll talk somewhat about the kind of why does it matter and the whole equality, equity. There's an expanded communication model, and I think I'm hoping that Jenny will speak to that for a minute, in a couple of minutes. And there are 5 examples of different goals and recording and review materials for them. There's 12 of those. So the hope is that that's a bit like Blue Peter, you know, here's some we made earlier that gives people an idea of what they might do. And we're hoping that people will share some of their good practice examples, and the next lot of main goal-based outcome guidance will have some phrases about broader accessibility. Next slide, please.
So I think this is the model you were talking about, Ro.
Yes.
So yeah, just very briefly to say again, I think that our kind of our mantra when we're thinking about children and their rights is that we're talking about not just about the child and thinking about anything that might be located within the child, but we're also very much thinking about the other person who's communicating with them or people around them and the interactions that they're having, and also the impact of the environment. So that's how we would conceptualize any difficulties that are kind of of being presented our way, but also if we're wanting to listen to children and young people, or we're wanting to set goals or anything, that we would try and think about all of these elements in order to have the best chance of best hearing what the young person is wanting and needing. That's it.
Thanks, Jenny. Next slide. So these slides are just the a flavour of some of the examples. So basically, there will be a little description of a child and a description of the goal, what's it about, and then some pretty pictures. For each example, there are a range of pretty pictures that you could use, and they're all on the 0 to 10 scales as we're supposed to use. Next slide, please. That's his bedtime. This is one about emotions, using somebody's images from somebody's favorite film. Next slide. Again, a bit of a feelings one about getting calmer, and some tools that a person is using to help them feel calmer. Next slide. Thinking about the opportunities and challenges that have presented themselves, I guess, from this project, and also thinking about what we've been learning from Julian and Victoria, that there are things that we can draw on and use that are helpful. It is possible. We want to make sure that we're using the data, not just collecting the data, and sharing the data, and thinking about using that across different levels with an individual, with a service, and making sure that we personalize and collaborate. Some of the challenges that have come out, particularly in Julian and Victoria's, thinking about a sort of personalization versus standardization. Validation, the adaptations needed. They were talking about the complexities of scoring and visuals and content. Again, there can be challenges for us to use the data or to share the data. And then we're going to get on to thinking a little bit more about conceptualization of mental health and well-being. So I've just put measuring what, for whom, at what level, and how do we make comparisons. I'm just aware of the time and don't know whether we have the time to skip through the next ones or whether we just stop there.
Sorry, Ray, if you want a couple more minutes, I think that's okay.
Okay. Just to say that we have put in some conceptualizations which may or may not be familiar for folk, but they kind of illustrate some of what both Jess's introduction and the first presentation gave. So again, this is an interesting website to have a look at. Next slide. This is possibly newer and closer to some people's hearts, as this is a project that Anna Freud and Cork are involved with the Be Well, which is both in Manchester and Hampshire and the Isle of Wight, I think now. So the youth steering group's understanding about well-being, mapping on to what Jess was talking about earlier, understanding yourself and your emotions, feeling like you have meaning, purpose and control in different areas of your life. So that's what they came up with. Next slide. They also have these areas of well-being and influence on well-being, the drivers, which again map to some of what Jess was talking about earlier, but this has very much been come out from the collaborative sort of research development project that's going up there. So we can see meaning and purpose. Well, you can read for yourself, and we haven't got a lot of time, but you can go back to it. Next slide. Which kind of brings us back to this multi-layer and influence both ways. How we experience our environment can influence us. If we can make a contribution or influence things around us, that can contribute to our well-being. Do you want to add anything, Jenny? Just keep going.
Nope, keep going.
Okay, next slide, please. And back to equity and reality, etc. Jenny, anything to add?
Nope.
Next slide. This is a rather lovely video. We haven't got time to look at it, and even if we did, it's got a swear word in it. So we just encourage you to have a look yourself, because this is a very powerful example about some of the barriers that folks might encounter, and how some of the assumptions we in society might make may not be helping at all. Next slide. Yeah, so we tried to summarize, showcase signpost, think a little bit about linking, and now we're going to think how this maps to the earlier presentation, Q&A and panel. And then there's just a couple of follow-up sort of queries or not queries, please, I guess. So Nipte at Cork would be really keen to hear from or collaborate with folk doing interesting stuff with measures and data collection. And for the accessible goal-based outcomes, very keen to have others share resources and examples to grow the pages. So there's a contact sheet there that people can follow up. So, and then there's some references. So presentation ends there. And thank you so much for your attention. Thanks so much for the invitation. Thanks so much for the earlier presentations. And we look forward to some Q&A and discussion.
Thanks so much, Ro and Jenny. Loads of really rich learning there, and I appreciate it's hard to get through it all in the time we've got. But just a reminder to everybody that Ro and Jenny had generously put more content on the pages than perhaps they could go through in terms of some of those references and things. But we will be circulating. The slides will be available afterwards, essentially, as well. And of course, you'll be able to go through it on the YouTube channel when that's there as well, so plenty of time. But we will move on to our Q&A session. Just a reminder to put your questions in the chat, but I think Martha's going to chair us in this session. Can I just ask those who are going to be on the panel to just pop your cameras on, and I'll hand over to Martha.
Hi. Well, wow, that was so much information. Thank you, everyone. It was brilliant. Loads to think about, and people are going to start popping things in the chat. But I think it'd be nice to give our speakers a bit of a break. And I'd like to hear from our champions, kind of get a bit of a reflection on what you've just heard and what you kind of thought. So I'm leaning towards picking on Dylan first. If you want to give a couple of thoughts on what you've just heard, that would be great.
Yeah, that was brilliant. I really enjoyed listening to you. I have lots of thoughts. I'm not sure where to start. I guess one thought I was curious about was kind of when you're thinking of outcome measures and giving that to a young person. I was wondering, like, you've done a lot about the actual measure that when they get it, they're receiving it. This is what they see. How is it accessible? How is it understandable? But I was wondering also about if you had any considerations about how that feels for the young person, about who's this person that's giving it to them. What's the context of that? What's their motivation about answering this stranger, perhaps? Or I don't know if that's quite a vague question, but just a general idea that I was coming into my mind. I don't know if anyone had any ideas about that they wanted to share.
Shall I talk about from our perspective, from what we learned? So yeah, it was a really complex and a really important thing to discuss, actually, and it came up very quickly when we were talking with the co-researchers and also with the focus groups before. And while we have created it and it's within POD, which is a very specific I suppose IT suite that can be utilised within the NHS and other areas. One of the things that it would be really great, I would love to look at this, is exploring how else that this can be made accessible and for different reasons and different ways. So the co-researchers and other young people very specifically said that filling in a measure like this is really useful to potentially share with professionals. So they did want it to be able to be shared. So we're looking at how we can create graphs and different things to demonstrate that. So they wanted to use it as them being empowered and being able to be in control of their data and their information. So that's one kind of thing. And then the other side of the coin was actually a lot of in fact, all of the young people that we spoke to said, we want this to be something that we use for ourselves as almost as a bit of a tracker, so that we are able to be in control of what we're looking at when we're filling it in, you know, for us to be able to see correlations and things that were important, and incorporating that more information. So obviously we've only very lightly showed one element, but we kind of covered anxiety and depression and elements within that. But they wanted so much more to be captured. So I think that's where it becomes more personalized, and we need to think more about how that then gets created so that it's accessible. Is that, you know, is that an app? Is that, you know, a link to a website? Is that, you know, Julie's probably like, oh my God, Victoria, going off. But these are some of the things that they were thinking about. And, you know, there isn't a set answer right now, but it's absolutely a really important point that you brought up there about who's going to be using and accessing the data as well. So yeah, really great question. I don't know if that answers a little bit of what you were asking.
Thanks, Victoria. I think Ro's going to come in now.
Yeah, I thought it was a great kind of question, thought, and a couple of things that sort of struck me. And I think building on what Victoria was just saying, it's absolutely vital to sort of set a context and try and establish rapport, say, you know, what are we doing? Why are we doing it? So certainly my understanding of some of the, well, most of the research that Court will have done around this is very much making sure that we're not using any tool like a sort of tick list and you've got to do this and I've got to do it and my manager says I've got to do it as a practitioner, so I'm telling you you've got to do it kind of thing. You know, a very much more personalized kind of nuanced introduction to it, and it's almost like building the relationship and getting to understand what the tool is then enables a child or a young person or a parent to answer sort of truthfully. Otherwise you can get sort of suggestibility, what's the right answer to this, plus comprehension issues, too frightened to say you don't understand. So there's a whole range of issues sitting under your question and reflection. But a great one.
Thanks, Ro. Jenny, do you want to come in now?
Yeah, I really like that question. Thank you, Dylan. It was making me think about some of the projects. So I would go back. I find that 3 R's model really useful, because I would go back to that in terms of just when I'm in whatever I'm doing with another person. Am I regulated? Are they regulated? How are we going to relate together? And then how can we ask those kind of questions? And it was making me think about a group that we ran in Bristol a little while ago, with a group of young people with kind of more moderate to severe learning disabilities. And we really had to think about that, because we had young people who were coming in who perhaps had never really been asked before what they thought about things. So we almost had to show them that we're interested in what they're thinking about. So we did that in a way. We started actually by but just each time we went weekly, and we brought different things for the different senses. So we might bring horrible fishy smell or a lovely jangly sound or whatever, and just get them to say to us, I like it or I don't like it. And it was really at that very basic level that we were trying to say, right, we're going to regulate by coming every week and you're going to get to know us and then we'll have a relationship. And then just beginning to show them that actually what they said mattered and made a difference to us. So I think for me, holding that, always holding that in mind, that what you say matters, and I'm going to do everything I can to set things up so that I can hear what you say. And that's, you know, that's one example of that, when you can't necessarily just ask a question in that more in that way. So yeah, that's how I hold in mind that the importance of what you're saying.
Thanks so much for that. I just wanted to move on to Parvin now and kind of get a sense of what you thought of everything you've just kind of heard. And if you had any questions for the panel, that would be fantastic.
I didn't really have any questions per se, but I did really like the idea of it. It's definitely different to anything that like I've seen that's been used. I think as someone who's used like the previous sort of measures, something like this would definitely be very, very interesting, and I think could be really beneficial to some people. So I quite like the sound of it.
Great, thank you. So I'm going to move on to some other questions now. So one thing that did come in the chat, which Julian has partially answered and Vic has kind of referenced to, was around some of the stuff and the image-based measure and the kind of technological aspects. I think it's really great that we've been able to develop this using technology. But one of the things that has been raised around actual accessibility of technology for services and the people that are potentially going to be using this, and not having Wi-Fi in schools. And I know that we're at a very early stage with this and you've given a partial answer, but it would be great if Julian or Vic could speak a bit more about that, just to give us a bit more of a sense, because I know you've thought about it, but it would be great to hear a bit more.
Yeah, thank you, Martha, and thank you, Emma. It was a really good question, and I guess it was making me reflect kind of more broadly, similar to what kind of Dylan was talking about. It's about the kind of, we've been talking a lot about kind of individuals understanding their experiences and how it might be kind of them in the context, not just how they're doing, but also we need to think about the measures and how we're using them and what context we're using them in. I think we've tried to build on kind of some of the approaches we've been using already, this pod platform, which we know is already kind of used, so has addressed some of those barriers in different settings. I think there's probably going to be kind of two prongs to how we take the work around implementation forward. I think one will be kind of working with settings we've done a lot of work about kind of implementation, adaptation and sustainability barriers. So I think we can kind of take that learning about kind of intervention more broadly and apply that. But I think we'll kind of need to work with different settings to really kind of thrash this out and identify what might be some of the technological barriers. But I think it's also going to be about kind of how it's being used as well. So perhaps it can be used, if it can't be used in a session, maybe there's a way of it being used by the young people outside of a session. But then if that's the case, how can we, as Ro was saying, how can we still make that part of the kind of therapeutic process still within the context of the relationship? So yeah, I guess the kind of I was thinking about the implementation context, both in terms of the kind of IT barriers, but other ways in which it was used.
Thanks, Julian. That was really well explained. Jenny, I think you wanted to jump in.
Yeah, I mean, I was really interested, Victoria, in what you spoke about just a little while ago, the bit where you were talking about empowering children. The children and young people were saying, we want to own this. We want to be able to say, I'm going to share it in this way. And I was thinking about other applications that we kind of think about in the work that I do. And, I was imagining a kind of an app. So rather than it being held by the school or the clinician, that actually it was more about young people saying, oh, I'm going to come to a session with somebody that I'm working with, and I've got this app and I can show people this is where I'm at, if that makes sense. And I wondered if that might also get over some of the barriers that sometimes bigger institutions have around things like technology. But I don't know, again, whether that's just very blue sky thinking. But yeah, that shift feels really important to me, of people owning their own where they are and where they stand.
I think that's a really good point. And Lucy in the chat has actually kind of come around to that and sort of said that this sort of individualized option approach seems like it would be something that would really work for her son, but has also kind of raised the question of sort of what mechanisms could there be around that? Is there actually funding for these measures to be used in different services? And are there things in place for people that have needs identified through it as and when it's kind of out there? I know we're again going kind of 10 steps ahead, Julian and Vic, but any thoughts around this would be great.
I just wanted to add, I think it connects a little bit with what everybody is saying, or what I've understood from what everybody's saying, that I think it's really important that we create measures and things that facilitate accessibility. But then the other side of the coin is that culture shift of facilitating, enabling, and encouraging the space for individuals and organizations to shift how they do that. Now, that's not obviously what we're discussing today, the broader thing, but I think these are a really good starting point. And I think like the video that you have, Ro, put on, I think is a really good example of us kind of looking beyond, this is what we think individuals should and could do, and facilitating that accessibility to engage with that. And I think in terms of providing that accessibility, in terms of what we were saying there about that individuality, I don't at the moment, I don't think, unless Julian, something that I don't, in terms of the ability for further funding for for individuals. We don't think we're there yet. This is quite embryonic and at quite a new stage for us to see whether this is something that could work, and what are the things that we need to consider for it to then be taken into then combating about those things, if I'm correct, Julian.
Yeah, thank you, Victoria. I think the only other thing I would add, so the measure would be free to use, so we wouldn't be kind of, there wouldn't be any kind of cost implications for it. I think this kind of idea about, okay, you've helped someone to reflect on their experiences, identified what's going on for them, kind of almost, so what's next? As Victoria kind of has mentioned, this was something that was at the forefront of the co-researchers' minds in terms of how they could see and track their own data. And they also had ideas about what we could, how we could build in self-management recommendations. We are starting to work on another project that Jess is leading, so we're working on kind of funding applications for it, but that is really going to, it's doing something a bit different, but it's really trying to help with, how can we use information people are telling us through things like image-based measures and other tools. How can we use that to give tailored, personalized recommendations, and then how can that then link to other forms of support they might be getting from the system? So yes, probably another partial answer, but I think it is, I think it is an important one, and the one we're trying to kind of think about in different ways as we can.
Thank you. I think the answer here is we're just too cutting edge. This is so new. We're just not quite there yet. So I'm very conscious of time. So we're going to do one quick question. I'm going to pick on a couple of people. So I think the thing that's really come out of everything we've talked about today is around measures and the need for these kind of changes and where we're thinking about things, but really actually embedding the people that these measures are going to be used on, be they young people, practitioners, parents, etc. So I kind of want to turn to maybe Parvin, Dylan and Jess. I think everyone else has talked enough. And just sort of get a sense of just one quick idea of how you think, based on some of the things you've heard today about how we have included the people that these measures are for in the development of new ways of doing it and refining them and making them more accessible. What's one thing that you think we could also do or keep doing or do better? Does that question make sense to anyone, or did I say too many words? Go for it, Dylan.
So I don't know if this kind of asks that question, but one thing I was wondering about is when I've seen outcome measures before, they're kind of set, and I get that they're set for a kind of reason that we want to be comparing them. But I wondered, with the kind of advent of the technology and things, whether there was a possibility to kind of go back in or like review and change over time to see if it needs to change with different contexts, with different culture shifts or whatever, and get continuing to get the kind of young voice as that kind of goes along, instead of having a measure that was made with kids that were 10, 20 years ago, if that makes sense.
Yeah, I think that's a really great point. Right, Jess, do you want to go next?
Yeah, I agree with that point. We were having a chat the other day about some of our slightly older measures still, and then some of the wording is almost hilarious, to be honest. That is really outdated, and probably some of the things that I think aren't outdated probably are as well. So yeah, I think that's a really key theme, is to keep doing this alongside young people and parents and carers, to make sure that what we're collecting is relevant, is meaningful to them, and reflects their priorities and interests. And I think, you know, there's some really nice examples in the work we've seen today of how that works, but we could definitely do more of that. And you're right, I think we can. Yeah, Julian mentioned a project that we're going to be working on. I think this more person-centered approach, we have to start accommodating, because there's always a trade-off between psychometric rigor to have, you know, comparable data and things. But there is a real need for this to be relevant and important if we're going to ask people to spend their time on it. So I think we've got to find the compromise there. And I think the technological advances and AI advances should allow us to do more of that. So we need to take advantage of it.
Thanks, Jess. I'm going to kick it over to Parvin and then we'll close.
Yeah, I think sort of following on from that, definitely making sure that over time you're talking to like young people so it stays relevant. But I think also, just from like a diversity point of view, talking to people and young people specifically from different cultures, just to make sure it's something that's accessible to them, or that especially people of color, like, or like immigrant families, feel comfortable using and like expressing. I know, speaking from like personal experience, it can be hard like expressing emotions just in general. Just making sure that they're comfortable with those, a sort of measure as well, is really important.
Thanks, Parvin. I'm going to hand it back to Jess to close us out.
Thanks, Martha. Yeah, if we just flash the last slide of Ariana. I normally do a bit of a summary, but I think actually, yeah, Dylan and Parvin's final comments might have just wrapped things up nicely. So it just remains for me to thank all our speakers, to our panelists, particularly Parvin and Dylan, for joining, and to Martha for chairing that, and to Ariana and Bea and Rachel, who work behind the scenes to help this all go smoothly, because I definitely am not the master of technology. Just a reminder to follow us on Twitter if you'd like to find out more about more events like this, or indeed we disseminate all of our information about activities and research findings and so on through there. So please do that. Don't forget to look out for our key findings, and also, just as you leave, you'll be directed to a feedback form, online form. It's really helpful for us to hear about how you found this, what else you'd like to see, how we could improve even more. Yeah, because we put these on several times a year, so we always like to sort of get some feedback about what we could do to to cater to people's interests. Yeah, so I think we'll wrap up there, and hopefully there's still some sunshine left out there for people to go and absorb. Thanks so much for joining us. We really enjoyed the discussion.